If you've ever been to a chiropractor for back pain, you may have heard them say that one leg is longer than the other. Hi, I'm Dr. Dave Candy, and I'm going to explain a few reasons why you may have one leg that's longer than the other, how it affects your back, and how you can correct it on your own. Now, there are a couple different types of leg length discrepancies where one leg is longer than the other or one is shorter than the other. And the two main classifications are a structural leg length difference or a functional leg length discrepancy. So for the structural one, it means that the leg is actually shorter. That can either be because your bones grew to a different length as you were developing, or it can be if you've got really bad arthritis in, say, one hip joint or one knee joint, but not in the other, then you can potentially lose a little bit of space. So either it didn't get long enough to begin with, or it shrunk a little bit over time just because of your joints. Now, sort of a medium level between a structural and a functional is if you have knee arthritis or you have a contracture in your knee and you can't straighten your knee all the way. Because one knee is straight and the other knee is bent, it'll make it function like it's actually shorter. And in that case, that's more of a functional leg length discrepancy, but if you have really bad arthritis in the knee, that may not be a discrepancy you can correct anymore. So what's the other classification? A functional leg length classification. And that's where your legs are actually the same length, but they appear different. And that's the type that if you go to a chiropractor or a physical therapist and they do a manipulation on your spine or a manipulation on your SI joint, they may look uneven and then magically they're even again after the treatment. And that's because of either a malalignment in the pelvis or a malalignment in the spine. So there are a few different ways that can happen. One is an SI joint dysfunction or a sacroiliac joint dysfunction, where the sacroiliac joint is this area back here in your pelvis, where your ilia join with your sacrum, the lowest part of your spine. And those have very small amounts of movement, about 1 to 3 degrees of rotation. And if one joint gets rotated either forwards or backwards, let's say forwards in this case, it'll bring the acetabulum, the hip joint, closer down to the floor, which will make that leg appear longer on the side that it's rotated downwards on. Now, another way that you can get a leg length discrepancy would be from an imbalance in your lower back. For example, if your quadratus lumborum muscle on one side of your spine got into a spasm and it pulls you up like this where one hip gets hiked up, then that leg will appear longer even though it's not actually longer. And so if you do have a leg length discrepancy, you need to, number one, find out whether it's a structural problem, whether the bones are actually different lengths, or whether it's a muscle holding pattern where either your SI joints are out of alignment or your lower back is out of alignment. So what do you do in the case of a structural leg length discrepancy? Well, first you need to find out if you actually have one. And the way that you do that is very simple, but a lot of people, chiropractors, physical therapists, and doctors, just don't look for it. But the way that you do it is you take a tape measure and you measure from your hip bone right here, your ASIS or the bone right on the front of your hip, down to the bump on the inside of your ankle. And I've got another video that'll show you exactly how you do that. But after you've determined that it is in fact that the bones are different lengths from the bump on your hip down to the bump on your ankle, then you can't make your bones grow or shrink without using a saw or something that you probably really don't want to use. So what you have to do is you have to accommodate for it. Now, if it's a small leg length discrepancy, say less than ½ an inch, you can usually buy a little wedge that you can put into your shoe, and I'll put a link to where you can get one of those on Amazon. They're really inexpensive, and you just slide it in the shoe of the short leg, which will functionally level you out so that they're more even. Another thing that you can try doing is taking the liner or the insert out of the shoe on the long side, which will functionally shorten that side. but because the bones are actually different lengths, you can't fix it, you just really need to accommodate for it. Now, in the case of a functional leg length discrepancy where the bones in your legs are actually the same length, you're just holding things in an abnormal position, you need to correct the muscle imbalance that's holding you in that abnormal position. Now, I mentioned there are two problems. Either the SI joint is rotated and it's bringing one side of your pelvis in a rotation forwards like that, or backwards the other way, or that you're tight on one side of your spine. So if it's the first problem, where your hip flexors usually are tight and they're pulling you into a rotation that way, you want to stretch your hip flexors. If it's a problem with the quadratus lumborum muscle right here, you want to stretch your quadratus lumborum. But if you don't really know and you don't really have anyone to analyze it for you, then a simple thing you can do is just stretch them both. And you can do that really with one stretch. So what you would do is you would kneel down on the floor like this and roll your pelvis underneath of you. That creates a stretch on your hip flexor. And if you don't feel enough of a stretch here, you can push your hips forward a little bit until you do feel a stretch there. Now, I would encourage you that if you're going really far forwards like that, you probably haven't tilted your pelvis enough, because you don't want your back to arch as you're doing this. This just tips the pelvis more forwards, which is the opposite of what you want. So roll your pelvis underneath of you, then just push your hips forward, and there you're stretching the hip flexor, which is a good treatment if you have an SI joint dysfunction. And again, this is going to be the long side that we're doing the demonstration on. So the leg that appears longer, that's going to be this leg. Now, if this was an SI joint problem alone, this is really all you'd have to do. But if you're not sure, you can add in the quadratus lumborum stretch by putting your arm up in the air and stretching the muscle that runs between your rib cage and your pelvis, again, the quadratus lumborum, and just holding that position like that. So now you're stretching both at the same time. Both of these would be on the side that appears long. So it's kind of a catch-all, regardless of which one was the cause. That, in many cases, will correct it. Now, if you find out that doesn't take care of it and you need more help, I would encourage you to see a physical therapist, particularly one who understands this whole thing about functional and structural leg length discrepancies. And if you happen to be in the St. Louis area, we'd be happy to help you out with that here at More for Life. And if you're watching this from somewhere else but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.